I think we can make a start. Louise, do you want to take it away?
Yeah, we'll make a start. Apologies for the delay in starting, everybody, but thank you for joining us this evening. This event has been coordinated by the registrars in the East of England, and we also have our head of school, Dr. John Battersby, online and presenting a bit later. So we'll just do a very quick round of introductions. I'm Louise. I'm one of the ST2s training in the East of England.
I'm Raymond. Oh, sorry. Yes, well, I'm taking over then. Sorry. I'm Raymond. I'm an ST2 as well, doing public health in East of England.
My name is Megan. I'm also an ST2 in East of England.
And good evening. I'm John Battersby. I'm the head of school.
Excellent. So we have a presentation for you this evening, and then we've allowed ample time at the end for questions. We're expecting there might be a few. If you do have any questions as we go along, you can put them in the Q&A and we'll try and monitor them and respond as we go. And if not, we'll circle back at the end. And just to say that we'll be able to answer any general questions you have, but specific questions related to individual circumstances or individual chances of successful application we won't be able to address tonight. And just some housekeeping to keep your microphones off and let you know that this is being recorded to be made publicly available later. Oh, I did already see a hand. Was there a raised hand, Andy? Maybe not. So moving on to our agenda for this evening, we will go through, can you do the slide, Raymond, a bit of what is public health, and then we'll head over to John. We'll talk about the training programme, training specifically in the East of England region, a bit about life as a registrar, and then about the application process, and at the end, some useful resources and Q&A time. So next slide. So just going into what is public health, I'm guessing that around the screen, we have a wide range of experience and knowledge of public health. So just want to ensure we're all on the same page with a brief introduction to what is public health. The most common definition you'll hear is that public health is the science and art of preventing disease, prolonging life and promoting health through the organised efforts of society. And it can be thought of as specialising in the big picture. And then if you go to the next slide, Raymond. Now, I tried and failed on several attempts to succinctly capture what public health is. So we're just going to go to a short video from the Faculty of Public Health. It's about 3 minutes long and captures really nicely what public health is.
We've no volume, Raymond.
I thought this might happen. Give me 10 seconds.
Illness.
Is that
the care
working?
available to people once they become unwell
Yeah.
is an important part of supporting good health. But our journey towards a healthy, happy life begins long before we visit a hospital or a GP and is dependent on a wide range of factors. Public health describes the organised efforts of society to protect and improve our health from birth through to adulthood and older age. Public health professionals are particularly focused on reducing inequalities in health faced by vulnerable groups and communities whose economic or social conditions can negatively impact their health. Effective sanitation, access to healthy food, vaccinations, green spaces to exercise in, clean air, and strong community ties all shape our journey towards good health. And it is the job of public health to ensure that everyone has access to these building blocks of health. Public health is about gathering evidence and following the best science and practice to deliver initiatives that protect and improve the health of communities and populations at local, regional, national and global level, supporting better health for all, leaving no one behind.
For example, in the UK, we know that people born in the most deprived areas are likely to have a much shorter life expectancy than those living in the most privileged areas. They're also more likely to develop chronic diseases like high blood pressure, heart disease, cancer and diabetes earlier in their life, affecting their physical and mental well-being as well as their economic productivity. Someone who's unable to afford nutritious food to protect their health is also more likely to live in poor quality housing, experience increased levels of air pollution, and face barriers to accessing health services, all of which influences health across the life course. Though public health is about supporting health for all in society, public health professionals target their work to protect and improve the health of the most vulnerable. An example of this work in action is the global effort to end the ongoing HIV/AIDS pandemic. Public health work at home and abroad has focused on preventing transmission and targeting effective interventions like HIV testing, condom provision, effective treatment and PrEP to those communities most at risk. We are now seeing significant reductions in HIV-related deaths worldwide, a major public health achievement. This example also demonstrates the collective nature of public health and the key role of public health professionals in collaborating with other actors in government, industry, and the voluntary sector to deliver initiatives to protect and improve health at the population level. So whilst many programs of work to protect and improve health are led by trained specialists, good public health involves the collective efforts of society as we all work together to protect and improve our health. If you'd like to learn more about public health, you can visit the Faculty of Public Health's website and search what is public health.
Perfect. And then, so just following on from that, within the UK, we split public health into 3 domains. So that is health protection, which is focused on emergency response, infectious disease and environmental hazards, and is probably what the public know best from the COVID-19 pandemic. Then healthcare, public health, more interested in service improvement and access to healthcare. And then health improvement, focusing on wider determinants of health inequalities, and then the promotion of healthy lifestyle and healthy choices. And then just thinking about where you might work following the training program and as a consultant in public health. The majority of people leaving the program will go on to work in a local authority, so local council, in a local health protection team or in academia, but there are many varied options. People might work for national government agencies, UK HSA or OHID, also the NHS, or even non-profit and voluntary sector organisations, think tanks, policy groups, or more globally in global public health. So the options are many, and some people sort of carve their own career path based on their interests. So after that introduction to what is public health, I'll hand over to John.
Thank you very much, Louise, and good evening, everybody, and welcome to the webinar. And before I say anything more, a big thank you to Louise and Megan and Raymond for organising this and making it possible. So yes, I'm John Battersby. I'm the head of school of public health in East of England. That means that I oversee a number of programmes. The main thing within the school is the specialty training programme, which you're all interested in. But there's also a practitioner programme and a public health kind of fellowship type program as well. So we run all of those within the school. And it's great that so many of you have joined this evening and are showing a real interest in public health. So it's really good to have you all with us. I'll say a little bit about a day in the life of a consultant, just to give you a bit of a flavour. In many ways, one of the beauties of public health is that there isn't necessarily such a thing as a typical day. There are all sorts of variable options in terms of where you can end up working and what you can end up doing. So it can be very varied. Over the 20 years or more that I've been a consultant, I've worked as a director of public health and then worked in health intelligence in a public health observatory, and then in Public Health England, and I currently work in the UK Health Security Agency. So in those different roles, and the same for local authority colleagues, there isn't such a thing as a typical day, but a lot of your time as a consultant will be spent in meetings, preparing for meetings, in meetings that may be internal meetings within the organisation within which you work, or meetings with wider stakeholders outside the organisation. You may well, as a consultant, have some line management responsibilities, so there will be one-to-one type meetings with the staff that you manage, and potentially with other colleagues. If you're in a role such as a director of public health, or any of these sort of senior roles within public health or within different organisations, you might have senior management team meetings or board meetings. And then, depending on where you end up, certainly when I was a director of public health, I ended up having to do media work as well. So, a day might have started with an early morning visit to Radio Norfolk in my case, because I was the director of public health in Norfolk, and then a radio interview on all sorts of different topics. One that comes to mind was about head lice. I was asked all about head lice, and I think I upset my children because I said that head lice were common and everybody gets them. And I think I said that my children had head lice, and they weren't too chuffed about being having the population of Norfolk given that information. But there we go. So that was a start to the day, and then it was into the office. There's always a chunk of time spent answering emails, as I guess there is with any kind of role, and then I think that day there was sort of meetings with clinicians, with GPs, looking at commissioning decisions, and then possibly onto a meeting of the Primary Care Trust board, as it was in those days. That would now be an integrated care board, is the kind of equivalent. And that would be a varied agenda, looking at the finances of the organisation, important commissioning decisions, and always as well taking questions from members of the public and so on. So that's a bit of a flavour of the kind of things that one gets up to. There's also a proportion of time spent doing things like writing papers. If you're involved in commissioning services, which most people are in one way or the other, one might be involved in drafting specifications for those services, and then writing papers for decision-making groups, whether it's a local authority cabinet or an ICB board. Or in my case nowadays in UK Health Security Agency, one of the kind of decision-making groups usually are our director or chief medical advisor within the organisation. So there's those kind of activities as well, and then linking some of those activities will involve linking with other members of staff that are contributing to the work. So you may be meeting with analysts who are providing some of the information that you use, or other members of staff that are working with you. So all in all, it's quite varied. No 2 days are quite the same, other than I guess the emails. The emails are usually there most days, but I think that's not unique to public health. I think that's probably common to most jobs. Just finally, I guess it's worth saying that since the pandemic, we've changed quite a lot in terms of the way that we work. So pre-pandemic, I spent more of the time going into various offices, and a lot of meetings were face-to-face. These days, it's more varied. And I spend quite a lot of time on Teams and having virtual meetings, but do end up travelling into London and other places, particularly London, for face-to-face meetings from time to time. But the balance of that has changed, I think, for most of us in public health over the last 5 years since the pandemic. I'm not going to say any more, because hopefully that's given you a bit of a flavour, and there's other stuff for us to cover this evening, but I'm going to hang around and hopefully be around for the Q&A. So happy to kind of help out answering questions. And I have been involved in recruitments ever since it started about 15 years ago. So I've got some understanding of the processes. Thanks very much.
Perfect. Thanks, John. Anastasia?
Hi everyone.
You're very quiet, Anastasia.
Oh, sorry, is that better?
I'm not sure.
You know what? Oh, sorry, I'll just use my headset and then everyone will be.
It's okay. We've had a very
Okay.
technically challenged day. So
Is that any better?
yes.
Good.
Brilliant. Okay, sorry about that. So hi everyone, my name's Anastasia. I'm a specialty year 2 trainee in public health and I'm from a medical background. So what I think might be helpful is just to give a brief overview of the training pathway for us in the East of England. Raymond, if you could be my slides driver, that'd be great. So public health as a specialty is 48 months whole-time equivalent, which means if you don't have a master's degree, then you'll have an extra 8 months of what we call non-training time in order to be able to get the knowledge and skills that you need to be able to succeed in the training program. So effectively what this means, it's between 4 or 5 years of specialty training, but if you're less than full time or if you choose to go out of program, then it could be proportionately longer. And as a medic myself, I'll be referring to ST1 to ST5 as your specialty training year. So apologies if that's unfamiliar terminology, but that's how I'll be talking through things over the next couple of slides. Next slide, please, Raymond. So generally the structure of training is what we call phase 1, which is where we want to gain all of the knowledge to help us through public health. And then as we progress up to phase 2, which is where you start to think about gaining responsibility. So your first 2 years will be spent in a local authority placement. So that's between 24 to 30 months. And then everybody will go off to do a health protection placement, which lasts 4 months in our deanery. And that's taken at some point during your ST2 to ST3. After that, depending on what time of year you take your health protection placement, you'll come likely back to local authority and begin the transition into your more senior roles in phase 2 after taking your second membership exam. And then the last 2 years of training are spent at a more senior level, trying to work up, make sure you've got those skills to be ready to start work as a consultant. So if you don't already have a master's, what will happen when you start training will be you'll spend 6 weeks with a local authority and then you'll disappear off to University of Cambridge to undertake the MPhil in Population Health Sciences, which runs from October to July. And then after submitting your dissertation, you'll go back to local authority and you'll be able to put in all of the knowledge that you gained into practice. So when you start in the deanery, you'll be placed in a local authority. These are split into the North Zone and the South Zone. What that means is, because the East of England is absolutely huge, the local authority in which you start at, say for instance it's in the North Zone, you won't be expected to undertake any placements that are not in your original zone, unless you want to, of course. So there's lots of different placements. There's no guarantee that any of these will be available in any given year. This depends on supervisor availability and obviously how much space they have for registrars. But you'll be spending your first 6 weeks here, going off for the MPhil if you don't already have one, and then coming back to the local authority after that. So here's just a brief overview of the training structure in a very dry table format. But if you do want to have a look at this in your own time, then it's available on the FPH website. So what do we actually do in public health training? Well, I'd really recommend having a look at the Faculty of Public Health curriculum because this outlines everything that you're going to be able to do by the time you're a consultant. So this is 10 different key areas ranging from things like healthcare public health, health protection, academic public health, all containing lots of different learning outcomes that you'll be expected to meet. And the way that we stay on top of this, which might be familiar for those of us from a medical background, is an e-portfolio. And the way way that we evidence meeting these learning outcomes will be through your workplace-based assessments. So things like written reports, someone observing you speaking in a meeting or giving a presentation, for example, or having a case-based discussion with your supervisor. So having recently returned from my MPhil in Population Health Sciences, I thought it's a really good opportunity to talk a bit about it. And what this is really quite intensive master's course, which runs from October to July with in-person teaching in Cambridge. If you are part-time or what we call less than full-time, it can be done as a part-time master's over 2 years. And it's a really good opportunity to make sure that you're gaining a lot of really key knowledge and skills needed for your first membership exam, which I'll talk about a bit later. So it really covers a lot of your core bases in public health, like epidemiology, biostatistics, and how to use statistical software such as R. So within the East of England, if you're on the training scheme, you'll be undertaking the public health theme, which means that you'll be expected to take a certain series of modules, and there is a dissertation component, so lots of opportunities to put your skills into practice. Unfortunately, I'm going to end on a bit of a scary note, which is our professional membership exams. So public health, like a lot of medical specialties, has membership exams, and we have 2 of these. So we have the DFPH, which is the diploma exam. That's your first exam, and this is more of your written paper, so test of your knowledge. So everything that you learn on your master's degree. And you normally sit this between the March of your ST2 or the beginning of your ST3 in October. And then following on from that, you'll sit your MFPH, which is your practical exam or your observed structured public health examination, which is really a demonstration of how you can work in practice. So showing that you have these skills that are needed in public health. So I'm going to hand over to my colleague Louise, but if anyone has any questions about public health training or the structure of training, please do pop them in the Q&A, and myself and the other Reggers will do our best to answer them.
Great, thanks, Anastasia. So we wanted to talk a bit about why come and train in the East of England with us. So just to start with some geography, so you know where we are. On the next slide, the East of England Deanery or region covers the area directly north and east of London, and it includes the counties of Bedfordshire, Cambridgeshire, Norfolk, Suffolk, Hertfordshire and Essex. And it's a really large geographical area with a population of around 6.5 million, and it's quite a varied population. There's a real mix of sort of living areas from multicultural urban areas such as Luton and Peterborough, and some of the areas directly bordering London. There's also a lot of rural communities throughout all of the counties, and then coastal communities in Norfolk, Suffolk and Essex. And these areas all have different population demographics and going with that differing health needs. So it makes it a diverse place to work. And further to that, these 2 maps here, the map with the purple and orange scale shows the index of multiple deprivation, which is something you'll come across a lot in public health, and it shows going from the dark purple areas, which are the least deprived neighbourhoods nationally, to the dark orange, which are the most deprived neighbourhoods nationally. And you can see there's a real mix within our area of some, you know, at both ends of the scale, and some extremely deprived areas, particularly around our coastal communities. And the other map on this slide just shows the political diversity within our region. So we have all the major parties represented in the East of England, including the Greens and some Reform seats. And given that public health sits within councils and works, you know, it works within that political system. So working in such a varied political climate also makes the job in the East of England really interesting. And then just to show you some of the beauty and interest in our region, I've got some beautiful pictures. So we have historic towns and cities and market towns. So this is Cambridge and punting on the river Cam, and then the famous King's College also in Cambridge. If nature and outdoors is more your thing, we've got the wetlands area of the Norfolk Broads where you can go boating or see some beautiful sunsets. And we've also got coastal areas, as I mentioned, so you can go to Hunstanton and see the famous stripy cliffs, or the kind of picturesque beaches of Southwold with their beach huts. And so just going on to the next, thinking about living and travel within the east of England. So most placements will have hybrid working arrangements. So there is a mix of working from home and going into the office. Most placements, I think, have an expectation of some days in the office and some working from home. And the sort of deanery advice is go by the policy in place in your placement. So if your council's expectation is 40% of time in the office, then you follow that when you're on that placement. There are excellent transport links with trains in and out of London, and with that, a lot of people who live in London might choose to train in the east of England and commute in and out. Within the region, particularly travelling east-west, public transport is more limited, so you may need to drive, and there may be some commuting for placements. But there is a bit of development of the east-west rail, so hopefully that will help. And as I say, obviously it's up to you where you choose to live. Many people live in London. Also a large group are focused around the Cambridge area, with people often living there for their MPhil and then choosing to stay there afterwards. Just moving on to our registrar group. So we have a group we call Free, which is the public health registrars in the east of England. And all trainees in our region are automatically part of this group. And it's a group run by us, for us. In our region, there's about 40 to 50 registrars spread throughout the years. And we hold bi-monthly training and networking meetings. And we have an annual away day. That's a bit of a team building day, and a day to welcome all the new registrars. And this group provides a huge amount of peer-to-peer support. So all new trainees are linked up with a buddy in a year above them. And we're also in what we call our dynasty groups, which is kind of like a house group, but there's a few registrars in a group, usually represented across the years, and they're just there to be a sort of informal support system, or so you've got someone to go to if you've got a question and you're a bit stuck. So there's loads of peer-to-peer support, and there's also special interest groups you can join, like sustainability or academic groups if you have a special interest. So overall, some other reasons to train in the east of England that I might not have mentioned already. We have really strong academic links. We have 3 medical schools in the region, 6 universities with public health departments, and of course the University of Cambridge, where you'll do your MPhil. We have excellent peer support. We're close to London if you live there, but there's also several national placements in London, so people can usually commute to those from our region without having to relocate. The UK Health Security Agency has just announced that they will be developing a new national biosecurity centre in our region. So that's going to be in Harlow in Essex. And when it's complete, it will be the largest biosecurity centre in Europe. So that's quite exciting for the east of England. And to top it all, it's a wonderful place to live for work-life balance. There's good schools, beautiful countryside, coastline, and right next to a fantastic city of London.
Thanks, Louise. Yeah, so my name is Megan Call, and I am an ST2 in the east of England, and I'm just going to give you a quick overview on a day in the life of a public health registrar. So we'll start with a little bit of a recap of my own career journey. I am from a non-medical background, and like many people who come into the program from a non-medical background, there's usually quite a varied and sort of sometimes long and complex background that may or may not always include a lot of public health. So one thing that's really nice about this training program, it is the only medical specialty that allows people from non-medical backgrounds to join. And so we have a really, really diverse group of people who do get onto the program, which is fantastic because we all get to learn and share from each other's experience. This is animated, Raymond, so I don't know if you just want to click next very slowly. So I got my master's degree. I started off in nutritional sciences, and I went and got my master's degree, again in the nutrition world. So that's where I kind of started off in my first jobs when I moved over to the London School of Hygiene and Tropical Medicine. I started off there in the International Nutrition Group there, where I was a research assistant for about a year. And then I wanted to do a little bit more frontline work. So I moved into Newham in East London, and I was a community nutritionist doing sessions for pregnant women and children under 5 and healthy eating. But I think I really wanted to get back into more of a sort of data-based role because I think that I realized that's kind of where my passion was. So in 2007, I started working at Homerton Hospital in the HIV clinic, and I was a research assistant there and running clinical trials. Then I got really into infectious diseases, and so I found a couple of years later what was at the time my dream job, working as an epidemiologist, working in national HIV and AIDS surveillance at what was then the Health Protection Agency. Next then became Public Health England. And next then, as we all know, in March 2020, I did that job right up until the COVID pandemic kicked off. And then I worked full-time on the COVID incident response for a couple of years. We became UK Health Security Agency, the same organization, different name. And then in January 2022, I continued on as a full-time member in the respiratory virus surveillance team. So I had about 15 years of public health experience. And at this time, I was really looking for what would be my next steps. And somebody's asked in the question about the portfolio route, so I'll just speak very briefly to that. So if people aren't aware, you can gain specialty registration through collating a portfolio based on your existing experience. You follow the exact same curriculum as the people doing the training program, but you build a portfolio. And it's if you have that level of experience, you can do that. And I considered both routes. In the end, on balance, I decided that actually taking a bit of a turn off into the training program and gaining the experience in a very diverse range of different sort of settings in a placement basis, and gaining that experience also within a very supported environment whose one main goal was to get you through the program and get public health training. I felt I would probably end up doing that faster than I would have done the portfolio route, which I would have done on my own time. So that's nothing against the portfolio route, but for me, I felt like the pros of doing the public health training program outweighed the pros of doing the portfolio route. So yeah, so then last year in 2024, I started public health training. Next slide, please. So I, as you can see, already have a master's degree. It was actually quite a long time ago, but I managed to make the case that it was that with my experience was so relevant to the public health training program, I didn't have to do the master's degree myself. So I went straight into my local authority, what they call service placement, and I was placed in Luton Council, where I still am. Next slide, please. So I've been involved in quite a lot of experience, different projects, which is really what I hoped for when I started this program, things that are totally different from the really kind of deep and narrow focus and that I was working in before, which was infectious disease epidemiology. So now I've had the opportunity to work on things I never thought I would before. For example, I've been leading on an update of the needs assessment and updated strategy for domestic abuse in Luton. I have been working actually with Raymond, who's also in Luton, and we have been working on sort of mainstreaming an asthma-friendly schools program for schools to come on board to gain. So we've been putting together a accreditation process and document templates for schools to use. I worked on I set up and have evaluated a short pilot project to set up sharp spins and needle dispensers for the rough sleeping population in Luton to try and reduce needle litter. I am currently doing a evidence review on evidence around the mental health of Black elders and their carers. And I also developed a project on smoking cessation or smoking harm reduction, tobacco harm reduction rather, in the homeless population in Luton. So just a huge variety of different types of projects that I had never been involved in before and have gained a lot from those different experiences and the different types of work that I've been doing, like strategy development, needs assessment, some of the work I had done before, like valuations and doing some data analysis, but it's a really good mix. So this is and again, what John says is so true. There is no typical week in the typical day. So this is like a really mock-up of what my day might look like. But sort of one thing that I really value about the work, if you've been jobbing working out in the field prior to this program, one thing that it's really nice about this program is you actually have a lot of time to do the doing and do the thinking and do the writing that you might not have had before if you were in back-to-back meetings. So I'll have a whole half a day rather, to say, for example, work on my needs assessment for the domestic abuse, and then the afternoon I'll could be preparing for a consultation event with a group of domestic abuse survivors that we recruited from a local refuge charity. Then the next day I might be doing some document reviews and editing, and then I might go into a seminar, for example. There's team meetings and meetings with the collaborators that we work with to do some of the different projects that we've been setting up. There's been some time for data analysis, and then importantly, we have supervision through our educational supervisors and our clinical supervisors who are based on site. So you have usually well, as often as you need it, but for me, it's usually about once a week or once every other week that I meet and have some one-to-one FaceTime with my supervisor. I also am part of talk about this in a moment, FREE, which is our public health registrar group. I'm a secretary, so I'll be doing some of the work around my secretary work, and then I'll be maybe joining some other meetings like the Town Center Partnership meeting. And then hopefully, say, for example, on the Thursday afternoon, I'll have time for portfolio reflection, so I have time to do the paperwork side. And then on the Friday, I'll put it aside at the moment for studying for my diplomat exam, so previously known as the Part A exam. So lots of different things going on. My overall reflections on the program so far. I think it's been East of England is where I live, and so I really do love it here, and I think it is a great place to do the training. But what I would say is there's some really important, really great opportunities. I haven't had the opportunity to do my master's at Cambridge, but a lot of our base meetings are at the University of Cambridge and linked to the university. So, and I was able to audit 2 modules even though I didn't take the master's. So I think there's the incredible wealth of knowledge and experience from Cambridge academics that we always get to pick from. I would say working in Luton, this is a picture of Luton, and then as sort of the social determinants of health, and you get to see that really in action by working in the field, particularly in local authorities. You're really there at the front line doing the doing in a local authority area. And so you really get to see what maybe for me was a very conceptual idea before frontline. I think that's been really important for my practice. Another aspect is you really able to dictate a lot of your own time. So time management's really important, and being able to kind of juggle and prioritize. You may have multiple projects and juggle them, but you largely are kind of left to your own devices. So a lot of self-motivation is really important, but also as long as you can manage your time, you are sort of supernumerary to the team. So you have a lot of flexibility in how you do that role. So that's also been really important. I have 2 little kids, so that's been very great for me. As well as that, we have opportunities for teaching. So this is an example from our free day. So you have opportunities for learning and development that we get through the program. And then, of course, we have the actual free. So our group of registrars, and I end on this because I think this is one of the best parts of the program for me is getting another automatic cohort of peers that I get to, work through some knotty issues with, always ask questions. The free group in East of England has been such a group of really, really lovely, helpful, friendly folks. And you can see here, this is from one of our free days. There's a group who like to play music, so they played us Christmas carols at our Christmas free day. They played for us, and it's good vibes. So, and this at the bottom on the bottom right, you also will get within that, if you join, your own sort of cohort of people that you go through the program with, which is really beneficial. So, and I'm happy to hand over to Raymond to take you through the next bit.
Thank you very much, Megan. So I'm Raymond. I'm a ST2 doctor as well, so I'm in second year, having just come off of the MPhil, and I'm going to talk to you about the application process, which is going to be very exciting, and I promise I'll try not to make it a dry thing when we talk about it. So firstly, what do we need to know about the application process? I'm going to assume that there's a broad level of knowledge when it comes to the application process of how you go through it. And if you don't have that, I suggest that you at some point go read up on it. But I'll skip over the basics of it. But in essence, there's three key stages to the application process. Number one is actually applying. So we only run recruitment for public health specialty training once a year, and it opens in the autumn time and closes in that same kind of 1 month period. So it's really important that you keep this in mind and you don't forget about it, because once that closing date comes, you won't be able to join in the cycle this time, and you'll have to wait a whole year. Secondly, there's the assessment center. So I'm going to call this assessment center or AC through this, but it's essentially just some entry tests, some psychometric tests used to set a kind of floor on the cognitive ability, we'll call it. But don't take offense if you don't do well on that at all. It's got nothing to do with it. It's psychometric tests, and those have a very mixed range of applicability. However, it's something that is part of the application process, so it's important to know about it. And then finally, we have the selection center, or SC, which is essentially interviews. So now that we have the jargon out of the way, it's apply, do your tests, do your interviews. It's quite a long thing though, because as I said, it's only one cycle a year, and it takes 5 or 6 months to get through it all. Most of that is just downtime, you waiting for the NHS to get back to you and tell you whether or not you've got the next stage to do or book or whatever. But it is important to be aware that it's a single cycle and it takes quite a while. As we've discussed earlier, it's open to non-doctor roles and non-doctor dentist roles. If you are applying through a non-medical route, you have an additional step to this during the application phase, where you have about 200 words to say why you're eligible from an experience point of view, which I believe is you need 4 years of work experience, 2 of which must be at essentially a managerial level in public health. But you'll be able to find the specific details to that online. And don't, I suggest you corroborate with what the official advice is for that as well. And finally, the last thing to note is, and we'll talk about this in a bit, but it's very common and very normal to take multiple attempts to get into the public health specialty training, as it's very competitive and has been for a long time. So many people, take a few attempts. And as a general rule, I would say that on average, the public health cohort is an older cohort. And so it's not really, frowned upon as other medical specialties might be, to spend extra time doing other things and taking more time to make sure that you've applied and do it well. Some key dates for you. I've highlighted in red the really important bit, because all of this hinges on you actually submitting an application. In October, applications open. and in November, applications close. This is taken straight from the recruitment timelines on the Health Education England page. But Thursday, 10th of October at 10 a.m., applications open. And Thursday, 20th of November, 4 p.m., they close. So please note that. And then roughly, there's probably about one development every month from that point onwards. If you're sitting the psychometric tests, the booking for that opens in December, roughly mid-December. They're not quite confirmed the exact date yet, so please keep reading that recruitment timelines webpage. And then you would sit the psychometric tests in January kind of time. You'll then, it takes them a whole month to let you know how you did, and then tell you whether or not you've got an interview. And then you'll roughly sit the interviews in March. But again, they'll let you know much closer to the time. And then another month or so after, they'll tell you how whether or not you've got a job offer. Of note, I've written here that there's 2 dates for the assessment centre in January. It's not a 2-day exam. You do not have to worry about that. You'll need to attend one, but it's just that there's 2 sittings. I'm not entirely sure if it's the same exam on both, but I would suggest that you try not to share any details of how the exam went on sitting 1 if other people are sitting on sitting 2. And this might just be an NHS thing, but everything comes a bit late sometimes, and unfortunately that's just the way it is. But there's no need to worry, because it's very common, and they do routinely update you and tell you when it's going to come out. Now, this is a bit of the depressing part. Public health specialty training is quite competitive. There's a paper out there, and you're more than welcome to go look for the paper. I've listed the title down at the bottom, about public health specialty training recruitment stats by Fran Burry, who's a consultant in public health now. But essentially, it talks about the numbers of people who overall and breakdown by demographics of how people progressed through. And there's a lot of information on this, but the key thing that I think is really important is that it's there's about 10% of people who manage to get through from their data. And there's 2 bottlenecks, I think, that are probably the key parts to it. Number 1 is getting an interview. They have a set number of interviews that they'll issue out. But you might do well enough to pass the psychometric tests, but you might not necessarily score in the top however many people that gives you however many interviews that they've decided to issue. So from their numbers, it was about 15% of that, of this 29% were left on the waiting list. Secondly, the next bottleneck is another waiting list situation where you might have done well enough in the interview that they would give you a job offer, but there are just not enough job offers to give everyone one, and then there's another waiting list. So here I've got 16% to 10%, which is about 36% left. On their website, in the frequently asked questions, they usually write the number of candidates they're planning to interview. Last year, there were 95 jobs in the country available, and about 2,700 applications for this. Not all of those, will have made it through, to progress to psychometric tests, but it's important to know what you're up against. And this is the bit where I think it's a bit even more depressing, is that's the data that was taken from was 2018 to 2020. Public health has always been historically very competitive, but in recent years, the competition has shot up across medical specialties as a whole. I'm not saying this to discourage you, but I think it's really important to know what the situation is before you apply. I'm not trying to scare you off, because the best time to sit it will be probably now anyway. In the future, it might go up, so you never know. And if it's a 1-year long cycle, you only get to apply once a year, and it takes 5-6 months to get through it all, you kind of need to know what your chances are as you progress through, so that you can make appropriate life decisions. Because if you're holding out for this for 6 months, you might be putting off taking up other job offers, other progression opportunities. So it is really important to know. This one I've just left here as a mostly for your information slide. In the past, we used to calculate final offer through a variety of means, summing up your interview and your psychometric tests to produce a rank. And then if you're ranked against everyone else at that stage, and then in the offer phase, you put your regional preferences, and then rank 1 is then given the first choice of region, then rank 2, etc. And if a region is filled, then you'll be given your second or your third or your fourth choice until every job is filled. Nowadays, we don't do that composite score anymore. We just use 100% of the interview, and then that interview score is your ranking against others. But what does that mean? That means that it's important that, yes, it's important you do well enough in your psychometric tests to get past, that initial hurdle. But once you get an interview, it's actually a level playing field. So, I said earlier, don't worry about what the psychometric tests say, because fundamentally, they are a little bit random, and they can be quite disheartening because you'll pick something that you think is appropriate, but then the mark scheme says something and you don't really agree with the reasoning. That's fine, as long as you do well enough to get through. That's all that matters. I've got a QR code for you, but also a bit of a plug. At Free, we have written a unofficial, I'll add, guidance document on how to apply to public health with quite a lot of tips and practical advice for writing and sitting the application. But fundamentally, you can either go by the short link I put there or by the QR code. We'll send that in around later as well in the Q&A, because we don't have a chat. But the assessment centre is made up of 3 psychometric tests. Number 1 is Watson-Glaser, number 2 is RANRA, and number 3 is situational judgment test. I'm not going to go into detail about these. That's why I've put the link for the advice document for you to read up on the exact setup for these. However, I'm going to give you a few important tips that I hope you remember and you can apply after you've read up on the test more if you haven't already. But it's fundamentally, Watson-Glaser is a logic test. RANRA is a mathematical reasoning test. It's not the same as a maths test or a statistical test. It's a entry-level maths test that tests how you can use that in a real-world scenario. And then situational judgment test, which is essentially you're given a scenario and you have to pick how appropriate an action is. I've just written this because I think this is more high yield for you than me talking about how to study maths or how to look up formal logic tests or whatever. Job test prep is the most advised, unofficially anyway, most advised preparation resource for public health specialty applications. It's very good for Watson-Glaser and RANRA. It is terrible for situational judgment, unless it's changed in the 2 years that I've sat it. And it's also quite expensive. It's like 55 quid for 1 month, 79 quid or something like that for 3 months. So it's really quite expensive. If you are doing it, and I still think it's a useful resource to have, but if you are using it, I heavily suggest that you look for discount codes. When I applied, I was able to use JTP 10 for month 1, and then I realized I didn't buy enough and I needed to buy an extra week. So I found another code that said JTP 20, and that worked as well. But I don't know if they still work, disclaimer. The other thing is that, because it's just the one resource, they don't have that many items on there. So if you're going to spend, like, let's say a month or so studying for it, because I think that's an appropriate amount of time to study when you're working and you're just doing this in your own time, you're going to run out of resources by the end of that month. And then so I suggest that you look for some alternatives. People will suggest a variety of things, but fundamentally the best examples are the ones on the recruitment website. There's not many of those either, but they are going to be very true to form. And those are the ones that you should base your kind of, is this appropriate meter on. I suggest that you also, find and create your own resources, because especially for Watson-Glaser and RANRA, these are basically variations of the same old kind of cognitive and psychometric tests. Watson-Glaser, you can go look up generic logic tests, but I will note that they're slightly different in the way that they're formatted and the way they ask you to think. So just take that with a pinch of salt and make sure that when you do those other tests that you think about the rules of the Watson-Glaser in those, and it doesn't matter if you get those wrong necessarily, so long as it's consistent with Watson-Glaser. With RANRA, because it's mathematical reasoning, there's quite a few of those going around in the professional world and the medical world. When I applied to medical school, I sat something called UCAT, which is like the University Clinical Aptitude Test. There's some very cheap resources available for that, and lots of resources, which is the other point. But they have a lot of quantitative reasoning questions at the same level, if not a bit on the easier side compared to RANRA. If you want to find some more challenging questions that, really challenge your reasoning, but are going to be harder than what's in the RANRA, you can look up GMAT questions as well. I suggest you use free trials for those because you're not sitting GMAT, and there's no point you trying to get 100% correct on those questions because that's not what you're sitting. So free trials for that one. For the SJT, unfortunately, I don't think there's a universal perfect resource. There's a few unofficial question banks and writing that's been put around I've seen, but I think fundamentally the most useful thing is using all that money we've sunk as a world into ChatGPT and other AI large language models to kind of use those official examples to generate sample questions and sample answers. But you do really need to babysit it because it will agree with you. So it'll tell you you're wrong when you do your situational judgment. But then if you say, why isn't it this answer? It will then say, oh, you're right. Maybe that is the right answer. And so it's a yes man. It'll always tell you you're correct. So it's not very helpful, but it's good to generate mass questions as long as you kind of use your brain while you're doing it. With regards to the selection center, so that's interviews again. Again, you can look up on the official website and read our document for a bit more in depth on how it's actually done, but I'm just going to give you some generic background and some more high yield tips. They call it a steeplechase format. I didn't know what that meant. I've never heard that format before. But what that actually means, it's a bit like a OSCE if you're medical, in that it's multiple short stations of a couple of minutes, each with one kind of task to do or a theme to its station, with like a very quick, very minute break between stations. And you go around, you'll do those, and then everyone will do a circuit of the same questions on the day of the interview, and then they'll mark you by their matrix, which is quite a long and extensive matrix. So it's not really that common that people get the same score during interviews. What makes a good answer for an interview question like that? If it's very short and focused, it's usually a good thing, especially given the format. So a structured, impact-driven answer is going to be effective. What I mean by that is something that clearly sets why your answer is relevant, using either real-world personal examples and what you did, and then kind of relating that back into the wider public health principles and understanding. And don't forget, you actually do need to answer the question. You cannot just word vomit all your achievements because you don't have the time to do that. Thirdly, the other thing that people will say in terms of advice for interviews is to read the person specification on the recruitment website. It's great. It is a good thing to read because that's what they're looking for. However, what they're looking for fundamentally is, what makes a good registrar. Not necessarily what makes a good consultant, which is another thing to keep a note of, or what makes a good public health person in general, but what makes a good registrar. And so therefore, you should really go read what the Faculty of Public Health put on their registrar curriculum, which you can just easily Google. As Anastasia mentioned before, there's 89 learning outcomes that registrars are expected to achieve over 5 years. And so therefore, if you have a look at those key areas under those learning outcomes and the specific types of work, the kind of specific skills they're looking for, I think it'll really help pin down for your interviews, what they actually want to hear. So that's it from me on the application process front. Again, I highly advise that you look at the guide that we have online. It's on the Health Education East of England website under the Public Health Recruitment section, but you can also access it using the QR code, which I've re-put up here. We've just listed a bunch of useful resources. sourced from our registrar body. This is the recommendations that everyone from our ST1, so beginning training program, up to our ST5s who are just about to finish and become consultants. So this is a very useful slide, I think, if you want to learn more about public health and being able to relate those into your wider kind of thinking. And some email addresses in there if you want to send further emails beyond this. We're going to open up to questions now. So I'm just going to leave this on the screen while we do that for another couple of minutes. But if you have questions, we will go through the ones in the Q&A. But if you have a question that you'd like to ask verbally, just raise your hand and I will manually unmute you.
I would just suggest, yeah, if anybody wants to put hands up for questions, we have been using the Q&A and trying to answer questions through there. So if anybody has any questions they are brave enough to ask out loud, if you have the question, probably a lot of other people are thinking it as well. There's no stupid questions, only stupid answers. So please do feel free to put your hand up and ask.
All right, I'm just looking through the Q&A section for ones that are unanswered. Someone has just asked, will the recording of this session be made available? Yes, it will be made available. We are going to figure out which exact route and where exactly we're going to host it. But if you fill out our feedback form, which I'm going to scroll on next to now, another QR code, then if you fill that in, we'll get your email and or well, if you optionally want to put your email in, and then we can send it out to you at a later date.
There's a question from Sophie. It's an easy one, I think. Is the MPhil fully funded? Yes. So I think one of the really big benefits of this program is you get a free master's degree from Cambridge. So not many people can say that. And it's offered to everybody, regardless of if you actually have a master's, you can still take this master's if you think it's going to be relevant to you. So yes, it's fully funded. We have another one. In terms of skills, qualities, values, etc., what differentiates a good public health registrar from a good doctor? I'll let my medical colleagues maybe take this one.
I think it's not necessarily the way to think about it as what differentiates, because I think fundamentally a lot of the skills that you learn as a doctor are really, really important. It's why it's part of the medical specialty training branch. You need the knowledge that you learn, you need the interpersonal skills that you get, because there's a lot of stakeholder management. But also, and you really need the analytical mind to kind of see things in the appropriate frame of mind. It's not always, when you're a doctor, you never just think of things as, oh, this is the disease, this is the solution. You usually think about things, what's best for who I'm working with, who this patient doesn't really want this, do we have a better alternative, etc., etc. I think that is actually very fundamental to public health, because it's in the name, right? We're doing it for the public. That sounds cheesy, but it's true. And then so being able to empathize and really understand other people's viewpoints, what's appropriate and what's right, does matter, especially because you're now working on a much larger scale and you actually have access to budgets, and spending money is now it needs to be justified. But what is a different skill, I think, that many doctors probably might not have trained is how to work in the long term. As opposed to working in a kind of day-to-day kind of, or even a weekly kind of basis. Because, Megan mentioned that she and I at Luton, we've been working on a program called Asthma Friendly Schools. That's been going on since, or at least the initial talks of it have been going on since last July, and we're still doing it now. So it's a really long scale project. It'll probably be going on for another year. That will be, still babysitting it until we feel happy to just let it go and let it self run. But I think that's probably the main thing that you want evidence as a registrar that differs from being a doctor. Thanks, Adel.
So the next question is, can you specialize while training? For example, could you specialize in young children and young people's health or in mental health? I'll take a first shot at that one. And just to say, so if you remember back to Anastasia's slides, your first couple of years is definitely set on quite generalist types of sort of placements or set placements, I would say. So you're in a local authority. You actually, to be honest, probably don't want to focus and specialize too much when you're actually in that setting, so you can get a bit of a broad range. And then you have your health protection placement after that. Once you're done with those two placements, you do have an opportunity to be more self-guided in the type of work that you do. So for example, we do have a midwife on our training program. She wanted to do some more advocacy work in that area of midwife. She got and sought a training placement at the Nuffield Trust, which is a think tank. But she went there, and the project that she planned was to do some sort of policy work around midwifery and maternity. So there are definitely opportunities within the program, particularly later on when you're finding your own placements, to find things that you think you would like to do as a future job or are just interested in looking into. And absolutely in your last year, the idea, your ST5 year, is to try and get a job in or around the area that you would eventually like to work in. So I hope that, I don't know if anybody has anything. Oh, Anastasia, if you'd like to add anything
Yeah,
to
I'm
that.
just
Yeah.
going to butt in on this because I actually had a conversation with one of my senior colleagues about this today. And public health is actually one of the very few training programs where at the end of your training, theoretically, you can do every public health consultant job. So I think there's a small caveat that if you want to do health protection, you need to have done a minimum of 6 months of health protection training. So you might need a bit more training to do that. But everything else you'll be qualified to do as a public health consultant after having done this training. So whilst there might be opportunities to pick projects that you're interested in or that align with your particular interests, ultimately it will be due to kind of what learning outcomes does your supervisor think you need to address, what are the needs of the service. So yeah, a bit difficult to say, but there should be opportunities to get involved where you want to as well.
I'm just going to go to Eli, who has raised the hand. I've allowed your mic now, so you can unmute if you want to ask.
Hi, Raymond and everyone. My question is, well, it's exactly what I asked you a couple of weeks back. It's about how exactly internationals can apply. Maybe you've mentioned it during this meeting, but I may have missed it. Can you please elaborate on that? I know you did talk about relevant experience and GMC registration, but I'm not sure what you meant by relevant experience. So if you could just elaborate on that, that'd be great. Thank you.
Yep, no problem. For context, Eli is a colleague of ours who was on the Masters in Public Health, which is why we've had a prior conversation for people who are curious. But he is a medical doctor by background, if I understand correctly, but not registered in the UK. And so he is asking from that point of view. My understanding is that if you're an international medical graduate, you need, when I say, you need to meet the eligibility of that, you need to, be GMC registered and, have the appropriate right to work in the UK. I can't really go into much more depth than that, mainly because I don't know as a UK graduate. However, there should be a bit more information on that specifically for international medical graduates who typically apply via the medical route. And then you can find that information via Health Education England, or you can email the recruitment office available on the official page, not the East of England one, but the overarching Public Health Recruitment Office, and they'll be able to advise you a bit more if you have very specific questions. With regards to experience, I think some international medics, for one reason or the other, may apply via the non-medical route, and some UK graduates may also do that. I believe that's usually if they haven't completed an equivalent of the foundation program in the UK. So they basically are, not, they're still in provisional qualification, essentially, not fully registered with the GMC. So I think that would be the argument there. And then that falls under the same kind of experience requirements that non-medics have, which I think, again, correct me if I'm wrong, anyone, but it's 4 years of work experience plus 2 years of which must be at a managerial level in a public health role. Does that answer your question, Eli?
Yes, and I also wanted to ask whether other themes within population health sciences count towards the master's program. Like if someone does a master's in epi or infectious diseases, does it still count?
So I can't comment on individual situations. However, as a broad general thing, your masters, and Megan, I might have to defer to you on this, but your masters will be compared against the curriculum and see whether or not it's overall appropriate. If you have any gaps, usually they suggest that you audit, i.e., you temporarily go for 1 or 2 modules at the university to fill that gap.
I see.
Yeah, but I think they use it pretty broad, like population health, public health, infectious disease, epi. There's quite a few different, it's not just a master's of public health, it can be quite a wide variety as long as, you've covered most of sort of similar basics concepts. Then they take a pretty liberal view to that.
Do you want me to come in on this one?
Yes, please.
Oh, yes.
So from a program perspective, if you've already got a master's in public health or in something closely related, epidemiology, for example, then we do not automatically put you through the MPhil in Cambridge. The couple of points really that I think are important to understand. A master's degree is not a requirement for the Faculty of Public Health curriculum. But all training programs at the moment use a master's in public health as a means of rapidly getting people covering the knowledge that's required, particularly for the diplomat exam, the old Part A exam. So if you've done a master's degree in public health or in a closely related topic, and that's going to adequately prepare you for the diplomat exam, then we wouldn't put you through the MPhil. There are a number of people, and I think Megan is an example of this, who've done a relevant master's degree, but perhaps need just some kind of additional top up in 1 or 2 areas, in which case, we make that assessment at the beginning of the year, and then would fund the relevant modules within the MPhil course for you to do those modules. So if you've done a master's in epidemiology, then we would expect that your epi and stats, for example, would probably be fairly up to scratch, and but there might be other areas of the syllabus for the diplomat exam where you might benefit from just some additional top up. So those decisions are made at the beginning of training, but that's essentially the approach for masters.
I see. Thank you.
I know we've got one hand up from Samuel. I just might quickly come in with just some rapid answers to some of the questions that people are not aware of before we go through. Catherine asks, is a really relevant question, as it's really important actually. For non-medics, are you able to negotiate salary to either maintain or uplift based on current role in LA? So the answer to that is pay protection is available for non-medics if you can evidence your pay. And there is guidance on the FPH website. An uplift, no, but they can match you straight across. So the main thing on that, so you would stay at that level, protected across the whole 4 to 5 years, with the caveat that as you progress in the program, if you're on the program's pay scale, you will get uplifts like throughout the program. And so if you start getting paid more in the program, then you can go up onto that level. But yeah, so it's important that you don't take a pay cut when you come in. And I have not heard of, and they actually did do some look into this. In the people that they looked at about who applied for pay protecting, 100% of them got that. So it doesn't seem to be that painful of a process. And the other question that I just would pick up is around the one that asked about elaborate on examples of what a band 6 looks like outside the NHS. Yeah, so that's not always actually a managerial level role, but it is not a junior role. So it's kind of like that mid-level, could be just before you even get into management level sort of thing. So it could be the equivalent of an HEO level if you're in the civil service is a band 6. And it basically usually kind of demonstrates that you at least have like a master's degree or you have several years of relevant experience before you get to that level. So it doesn't have to be managerial. That's not really the point, but it has to mean that you're working at sort of like a highish level in your field before you get into more of a middle management level. I hope that makes sense. Sorry. Samuel, you put your hand down. Did you want to ask your question?
Hi, good evening. I was just wondering, you may have answered it in the last part, but does the master's degree negate the need for the 2 years in a managerial position if you're going down the non-medical route?
No, so the degree really has no bearing. It's to do, if you're from a non-medical route, then it's really down to your work experience and counting up the time you've been in there. John, would you have anything to add to that?
No, I think you're absolutely right there. Whether or not you've got a master's degree is not relevant for the application process in terms of the requirements for experience. You still need to have that experience.
And that's specifically in management. So the 4 years and then 2 must be in management.
It needs to be in a public health role where you've got some evidence that you've been at a kind of level of seniority. Now, you don't have to be a very senior in a very senior role, but you do have to have some experience of at a senior enough level to be managing other people. So it's not just an entry level kind of public health post.
Okay, thank you.
We have another question. Yeah. Oh, sorry.
I was just going to say, I'm conscious of time. I'm happy to do a couple more questions. I don't really think anyone minds if we answer a few more questions. But just to reiterate, if you have specific questions about your situation or things that are a bit more not general, I suggest that you email the email, if I'm still sharing, I think I am, email the email on the bottom of the screen there, eoepublichealth@gmail.com, because that's run by us. But if you have more specific administrative questions, I suggest you either email the school or you go to that Health Education England recruitment page and email the Public Health Recruitment Office directly. We can try to, answer questions that help most people. But if it's really niche, I think it's going to be quite hard to fit in all the other questions. But yes, over to you, Megan.
Yeah, so I was just trying to get my colleague Emma, if she's on the line, to answer Harshveer's question about the GPPH training process. So hopefully she'll be able to answer that in the chat. And then we have a message from Chloe. Hi, Chloe. I know Chloe from my previous job. I think it's you. But yeah, so there's a question about preparing a PhD application in the ACF role. I think so. An academic clinical fellow tends to be somebody from a clinical background. I actually am not sure if they allow people from non-clinical background, but what I would say is that there are people from non-medic and non-medical backgrounds, whether they're in the ACF role or not, can apply to take a PhD and go out of program to do that PhD and come back into the program and finish. Kind of like you might have you could do the same thing for FETP training or something like this. So you are able as a medic and a medic to leave the program and go out of program, do your PhD, and then come back in. The ACF, I don't know I think Nusnus dropped off. She was doing that. Oh, actually, Raymond, you do the ACF, don't you? So over to you.
Yes. So what Megan says, from my understanding, is correct. That the academic clinical fellow is technically for doctors. I don't know if there's plans to change it or not, but you should just think of it as it's for doctors/dentists at the moment. However, what it is in practice is essentially 1 day a week where you are working with your university supervisor to prepare for a PhD proposal application. Typically, I think because there's the masters at the beginning, if you haven't done a master's before, typically, if you're interested in doing a PhD, you already going to have many academic links from that master's. And even if you don't have that master's because you've already got one, it's a very academic specialty. We've I think touched on the fact that you can choose your own placements after your local authority and health protection time, but you can choose your own placements essentially, and many of the eligible placements are with universities and research kind of groups. So you are very well placed to go do a PhD on your own. The ACF is kind of more impactful, maybe is the way to say it, in medical specialties or surgical specialties where they're on the wards all day and they don't really have, data on the brain all the time. So yes, I think you have plenty of other opportunities to. Might not necessarily be a set pathway, but in our registrar group, there will be many who have done it. And when you enter, if you're interested in it, just speak to people, and they'll be more than happy to talk to you about it.
Can I just step in with another and kind of a bit of an update on that one? Raymond is right that up until now, the formal NIHR, National Institute of Health Research, academic clinical fellowships have been restricted to people with medical degrees. That is changing. So this year, this round of applications, individual higher education institutes can join a pilot to open that program out to other people in public health. The other thing just to say is that within the program we do, when resources permit, we do locally fund academic clinical fellowship posts, and those are always open to everybody. And one of the reasons that we do that is to try and address the fact that previously the NIHR fellowships haven't been open to everybody. So I thought that's helpful just to update that is in the process of changing.
Thanks, John. Have we got any further questions that are not answered?
I don't think so. I think we are covered in the chat.
Right. Lovely. So thank you. Oh, we've got one more. I will just allow your mic, and now hopefully, sorry, it's not loading. There we go. Karen, if you would like to unmute, you can speak now.
Yes, thank you. And thanks everyone. I just wanted to ask, I did put it in the chat, but I don't think the answer really answered my question. So I was asking about a specific buddy program for people from Black and minority groups that is offered by FPH in order to assist them to do the application. I think because Black people are usually less likely to get in, there is a special buddy program that was created just for them. So I would like to find out how I could access that. And that's what I was asking.
I don't know if John has an answer to that, but there is a buddy scheme, yeah, that you can use. There's like, I think, an individual who has been nominated. If I can find the link, I'll send that in the chat. But there's, I think, 1 or 2 people in the region who kind of lead on that program. So I think you would reach out to them. So I'll find your comment and I'll put that in the chat so you can reach out to them separately.
Okay, thank you.
And the other thing, Karen, if anything that is organised by the Faculty of Public Health. There should be information on the Faculty of Public Health website, and if there isn't, then it's worth just dropping them a line via email, and they're usually very quick to get back to you.
Okay. Thank you very much.
I would just add for everyone in general, like we've said today, we can't really give you specific advice, exact details of how everything goes, and we can't really tutor you through the process for the sake of a fair application. However, if you are, still wanting to speak to individual people, either because their specific experience is useful or because, you think that they can answer a specific question of you, we are happy to speak to you. I suggest if you want one of us, you email the eoepublichealth@gmail.com email, and you can go through it. But, I suggest, if you are I'm certain across the country, most public health registrars are very friendly and would happily talk you through, at least, or at the very least, book a meeting, and you can have a proper chat about what your questions are, or if you have any specific advice or whatever. I had some help from colleagues who were in public health or had applied to public health recently. I think many people who have that kind of network benefit from it. So if you don't have that network, I think it's not that necessarily that's unfair, because it's just how the kind of, if you've worked in the field, you'll know people in the field. But if you haven't had those kind of networks before, I heavily suggest that you try cold emailing a few registrars. I'm sure they'll be very happy to speak to you. LinkedIn's a good way to find them. Otherwise, you can speak to well, maybe not consultants, but you can try emailing public health departments and ask if they're interested in, giving you a bit of information, or asking if they're interested in giving you a bit of experience. I can't guarantee that that will happen, but I know at Luton we are trying to accommodate people who are keen, but can't always promise.
Okay, I think we're happy to close that there. We've stayed on just a little bit longer because we were starting a little bit late. So again, apologies for the technical malfunction at the beginning. But thanks for everybody who has stayed on. I know a few people have dropped off, but again, if you have any questions, if you'd like to fill out a feedback form or get an attendance certificate, please do the QR code, or if you'd like to email us, as Raymond said, eoepublichealth@gmail.com. We will be putting the recording up on the East of England HEE recruitment page. And thanks everybody for coming along today. It's been lovely to see and talk to all of you, and I wish you the best of luck in your public health journey. So thank you very much.